Well, yeah, I mean, let's just start off with the valves are. So there's two sets of valves in the nose. There's your internal nasal valves, which are made up of the upper lateral cartilages and the dorsal septum, and also the septum and the inferior turbinate. So that's the internal nasal valve. And the external nasal valve is essentially the tip cartilages, which is the lower lateral cartilages. They both kind of function in a valve-like way. It's funny because, in pre-med, we take all these like physics classes and we don't understand like why do we have to learn physics? And I'm sure you guys are like, I don't remember anything about physics. But if you remember physics and some of the aerodynamic stuff, you're pretty well equipped to handle and understand nasal valve pathology. So when it comes to evaluation of nasal valves, basically the most telltale sign of a nasal valve collapse is dynamic nasal airway obstruction. What I mean by dynamic is essentially the breathing is affected by a couple of things. One is the breathing can get worse the deeper you breathe in, so that the nostrils or the external nasal valves begin to pinch, or they structural improvements in the nose will improve the airflow. So if you pull up on your cheeks, that'll also help the internal nasal valves get a little bit stronger and allow a lot more air to pass in. But these are structural problems, and it's really you have to kind of parse things out and try to determine, is this like a deviated septum? Is this allergies? Is this polyps? Is this internal valves? Is this external valves? So the evaluation can be pretty in depth.
And is it common that people have more than one thing, where it's like they have the valve problem, but they also have allergies and they also have this? I mean, I feel like that's a lot of what I see. Like maybe it's not just one thing.
Right. So like breathing is multifactorial. And it's I always sit down with my patients and you kind of have to do a really thorough evaluation, figure out what it is that's bothering them. But, it's not uncommon to have a deviated septum and some allergies. It's not uncommon to have maybe some internal nasal valve collapse and, a deviated septum. So you have to kind of sit down and kind of ascertain, what's the most impactful part of your nasal airway obstruction and what's the best kind of correction. Sometimes it could be sprays, sometimes it could be a procedure, but everything has its own kind of weighted impact on how you're breathing.